Hello, my name is Dr. Diane Williams. I'm a teaching professor and Associate Director of Undergraduate Studies in the School of Public Health and Health Systems, which is part of the Applied Health Sciences faculty at the University of Waterloo. I have the privilege of teaching students who have a passion for improving human health, starting right in first year right up through fourth year. And I always marvel at the growth and development and achievements in our students as they progress through the two undergraduate programs in which I teach. I feel lucky to be a part of the Applied Health Sciences faculty, which emphasizes solving complex health issues from many different perspectives. The Health Studies undergraduate program is a Bachelor of Science degree and the Waterloo version of health sciences. Health Studies takes a multidisciplinary approach, looking at how various systems can affect health, from the biological system to societies to the ecological system. We focus on preventing disease as much as treating it. It's better for everyone, the government, employers, people, and their families if people don't get sick in the first place. Other health professions also find a multidisciplinary approach effective. For example, the Medical College Admissions Test, or MCAT exam, was revised back in 2015 to better reflect the idea of multidisciplinarity. As quoted by an article from the New England Journal of Medicine in 2012 called Building a Better Physician, the Case for the New MCAT, the revised version now includes sections on behavioral and social sciences and critical analysis and reasoning. These revisions reflect the recognition that behavioral and social factors play major roles in health and illness. So the MCAT includes sections on human biology, molecular and cellular and physiology, on physical and biochemical properties of living systems, but as well as critical analysis and reasoning skills, which includes philosophy, ethics, and principles of population health, and then finally a section on social and behavioral sciences. These revised MCAT sections make it more in line with the Waterloo Health Studies program, and really that's the way we've been doing it for 40 years. This is consistent with our definition of health as being multiply determined. Students who choose health studies as their pathway to a clinical health profession, such as medicine, nursing, occupational therapy, and others, do so because they like to focus on human health and looking at the whole picture behind a disease. So why do we take this multidisciplinary approach? Well, many health issues are incredibly complex and require interventions on various levels in order to keep people healthy. So let's look at an example of a current major health problem. To use an example almost everyone should be aware of, COVID-19, which is caused by the novel coronavirus SARS-CoV-2. This pandemic is affecting most countries around the world, and unfortunately there's no vaccine or cure currently available, at least in April of 2020. It's a very complicated issue that requires interventions on many levels. Governments need advice from experts in public health to make far-reaching decisions about things like closing schools, regulations on social distancing, how to protect the most vulnerable people, and how to ensure that vital supplies like personal protective equipment can be made available to the frontline workers in the healthcare system. So let's go through and talk about how we use a multidisciplinary approach to address this issue, and you will see how this approach aligns with the curriculum provided to our health studies students. So first off, we need to take a biomedical sciences approach that includes treating people who are sick and developing new treatments. We need to understand how viruses like the SARS-CoV-2 that causes COVID-19 invade the body and cause pathology in the lungs, resulting in respiratory symptoms. We also need to take a genetic approach that includes sequencing the virus and analyzing different strains in different regions of the world to track mutations as well as to develop tests. We need to gather epidemiological data to predict how rapidly the virus is spreading and to better understand the case fatality rate. And then, of course, we need to treat people who are sick or develop new treatments or vaccines. So all of these are examples of a biomedical approach, and the courses that our students take, both the required and electives, cover all of these different approaches. And certainly this is a great approach, but it doesn't solve everything, especially if there isn't an effective treatment available or a vaccine. Our students have lots of free electives, more than 25% of their degree, to take additional science courses, or they can enroll in the preclinical specialization to tailor their courses towards requirements for specific professional programs. So the student in this photo is Rose, and she is one of our students who are accepted into medical school from our program after 3 years. And I like this quote from Rose because it really represents our multidisciplinary approach in the health studies program. Medicine is about understanding the big picture of health just as much as it is about understanding an individual's health needs. When we examine patients, we discuss issues such as the social and environmental factors influencing health and the healthcare system, topics I covered in the very first year of the health studies program. Our students who go on to clinical health professions have the tools and knowledge to not only treat their patients, but also to get at the root causes. They have a strong health advocacy focus that looks at factors beyond the individual, such as psychosocial and socioeconomic factors, access to healthcare, and government policies. So in addition to the biomedical approach, we need to look at other angles that influence increased transmission of this respiratory disease, as well as measures to decrease transmission and prevent too many deaths due to an overwhelmed healthcare system. It's important to understand social conditions that can lead to a disease spreading more quickly, such as, are there people at increased risk from living in crowded conditions or in areas without health infrastructure to handle people who are sick? There are ecological determinants like climate change and habitat destruction that have played a major role in the emergence of new infectious diseases. For example, new viruses emerge when they mutate and can make the jump from animals like bats to humans due to more interactions between humans and wild animals. These novel viruses can then spread rapidly and make people very sick since there's no immunity in the population. Then, of course, we have government policies that can play a huge role in these situations. For example, can people afford to stay home if they are sick? Is the government providing financial support to the many people who may have lost their jobs due to this pandemic? What regulations have the government put into place around social distancing or around making stockpiles of personal protective equipment available to those in the hospitals that need them the most? So it's important to also understand and protect those who are most at risk. And our students with their various courses in the curriculum learn that health is not static. Health develops over your lifespan. And our students will study both physical and biological, as well as social aspects of development. And all students will take a course that focuses exclusively on our aging population. Now, understanding the aging population is key right now for healthcare providers as the Canadian population is aging. In another few years, up to 25% of the population will be over the age of 65. We also have a minor in gerontology, and we have several faculty who do research in this area, including a geriatrician on our faculty who directly treats older patients in the clinic and does applied research to try to improve management of long-term care in frail seniors. Dr. Heckman, shown in this figure, also teaches the Introductory Aging and Health course, and he teaches a fourth-year seminar course in geriatric medicine and healthcare with only 20 students in the class, and his research includes supervising undergraduate fourth-year honors thesis students. With what's happening with the COVID-19 pandemic, older adults and people with underlying health issues are most at risk of dying from it. How do we protect them? There might be other issues as well. Are they able to access food from home? Maybe they aren't comfortable ordering groceries and they don't have anyone who can deliver them on their behalf. In our health studies program, you will understand how to address these complex biological and social issues that are unique to older adults with a systems thinking approach. In many cases, human behavior can play a really important role, not only with respect to infectious diseases, but also chronic diseases like cancer, diabetes, and cardiovascular disease. And when we're talking about infectious diseases, certainly regular hand washing can certainly reduce the spread of disease. And then how do we convince people to only go out when necessary? Some people are not adhering to the social distancing recommendations during this COVID-19 pandemic. Now, beyond behaviors around transmission of infectious diseases, the leading causes of death worldwide are chronic diseases, as I've just mentioned, cancer, diabetes, and cardiovascular disease. In many cases, there are behaviors that can be modified to lower the risk of getting certain chronic diseases, such as smoking and the link to lung cancer. These are just some of the courses that students can take to better understand human behavior and how to use health promotion techniques like education, social marketing, community engagement, and empowerment to encourage the adoption of healthier behaviors. And these are all important things to understand also for students who go on to clinical health professions like medicine or nursing. And there are also 11 free electives in order to focus your area of interest if you want to take more courses on the social behavioral aspects of health. Now, let's look at another perspective. It's important to understand how health research is carried out and how to apply both qualitative and quantitative approaches like statistics. Now, anyone working in the healthcare industry, from clinical health professions to researchers, must understand how health information is generated. During outbreaks like the COVID-19 pandemic, the government is highly reliant on advice and reliable data from infectious diseases epidemiologists. At Waterloo, you will be exposed to expertise in using information technology to improve the healthcare service delivery. Students are exposed to this field, giving them an edge over the next 10 to 20 years as the healthcare industry changes due to advances in technology. So, for example, all of our students take a course in health informatics, and in addition, students can enroll in a health informatics option, which combines courses in computer science with information management and health sciences. It's important to be able to assess the legitimacy of new health research findings, and our students are well prepared to do that. This is also an excellent background for graduate studies and highly sought after skills in statistics, health informatics, and health research methods that employers are looking for, including co-op employers in clinical research settings. Students can also specialize by enrolling in our health research specialization, which includes doing a fourth-year honors thesis. No matter what your career trajectory, our program has the flexibility to allow you to be well prepared. So now that you have a better idea of the breadth of topics covered in the health studies program, I'd like to share some information about what experiences you might have as a Waterloo Health Studies student. So this slide shows what the schedule would look like in your first year. Students have about 15 to 20 hours of class per week, and approximately 40 hours total when you consider time in class, in tutorials, in labs, and then the various readings and assignments and studying for each course. So students will have 2 labs in the fall semester, and each one is equal to 1 full course. So they'll have cell biology plus the lab and introductory chemistry plus the lab. And then, of course, introductory health course, and then a course on the sociology of activity, health, and well-being. And then in the winter term, they'll have the second chemistry course along with its lab, introductory psychology, course on the Canadian health systems, and then Introduction to Health Part 2. And the schedule is unique for each student. Students have electives as well. And a copy of this schedule is in the health studies brochures that are available online. I'll share the link to this brochure at the end of the video. So while many introductory courses have pretty large class sizes of 300 or more students, our students have first year tutorials and labs that are capped at 30 students. So right in first year, you'll be able to experience a small class size. Students have the ability to study real-world examples through both their small tutorials, seminar courses in third and fourth year that are capped at 20 students, and community learning projects, health apprenticeship courses, and others. There are more than 30 specialized upper year elective health courses in which faculty get to teach courses that cover their passion and their specific research interest. And these are just some examples, like courses on epigenetics and health that I teach, which again only has 20 students, a fourth-year course on geriatric medicine and healthcare that geriatrician George Heckman teaches, and then a course on the epidemiology of communicable diseases that just wrapped up this winter term and focused quite substantially on the COVID-19 pandemic, given what's happening in the world right now. We also have our tutorials in various courses, including Introductory Health 101 and Health 102. So again, these are small class sizes, and students get to discuss contemporary health issues, debate different positions, do some role playing, and practice a lot of critical thinking in these tutorials. So some examples of topics that would be covered would be infectious diseases that are of major global health impact, such as Ebola virus disease, HIV, and the SARS-CoV-2 virus that causes COVID-19, which will actually be a topic of this fall's version of Health 101. They discuss public policy issues such as taxes on sugar-sweetened beverages or regulations on the marketing of vaping products to make them less appealing to youth. They might discuss the pros and cons of taking different approaches to tackling the opioid epidemic, or learn things like how stress affects the body both physiologically and emotionally, and learn stress management techniques. So for example, one of the Health 101 tutorials on infectious diseases focuses on HIV. Students take a cell-to-society approach to understanding how HIV virus, the biology of the HIV virus, so how it infects cells of the immune system and the progression to AIDS. And they also study the complex social determinants that lead to increased transmission of HIV in certain vulnerable populations. Students have lots of opportunities to learn by doing via volunteer experiences, both on and off campus. So health studies and public health students can volunteer outside the classroom to gain even more practical skills. For example, they can help clients with cancer recover from treatment through exercise. They can run peer-to-peer health promotion campaigns through health services, or they can buddy up with students wanting to benefit from physical activity or mentor first-year students. So this photo is one of our students, Natalie, who volunteers with the Peer Health Education campaign on campus. Students also have the opportunity to get experience doing research. And interestingly, the Faculty of Applied Health Sciences, which is one of the smaller faculties on campus, actually has the second highest level of research funding per faculty member at the University of Waterloo. So that means that there's lots of research assistant opportunity for our undergraduate students, either through co-op, volunteering, or working as a research assistant. Now, two of the top public health researchers in the country are also here at Waterloo. Pictured above is student Tony Lee, who worked in Dr. John Milkey's lab on a summer NSERC research fellowship before heading to medical school after his third year in health studies. If you follow the link in the YouTube description in this video, you will learn more about Dr. Milkey's research on neurobiological embedding of adversity and stress. Another way that students learn by doing is through co-op. Now, Waterloo is home to North America's largest cooperative education program. So students get paid work experience during their undergraduate degree. It's one of the many ways to build your resume and gain experience during your time here at Waterloo. So co-op offers students the opportunity to gain 20 months of paid work experience. And the employment rate from 2018 was 94%. In health studies, you have a choice of two great ways to study, regular or co-op. Both are great options. Choosing the right one depends on your particular interests and goals. Regular provides a traditional university experience. You complete your degree in 4 years and have your summers off. This provides you with the opportunity to plan your own summer jobs, projects, or other activities. It also provides you with continuity in your studies and living arrangements and a faster path to graduation. For students in the regular stream, Waterloo offers the EDGE Experiential Learning Certificate to improve your career skills and market yourself to employers. On the other hand, co-op is a 5-year program in which students alternate between work and study throughout the course of their degree. The academic component of the program is exactly the same, but just with 20 months of paid work experience built in. Co-op does require extra work and dedication as students have to write resumes, cover letters, and go to interviews, but in the end, they will earn a Waterloo degree and have 20 months of paid work experience. We also have a whole department dedicated to helping students along the way. This chart provides you with a breakdown of how our study paths differ with the two options. Either way, it's the same 8 semesters of study terms, taking courses on campus. In the co-op stream, students start alternating 4 months of study with 4 months of work starting in their second year. So students who do the co-op option can try something different each work term or return to previous employers. And these are just some sample job titles from our students that they've had this past year. So common employment settings include clinical settings like hospitals or long-term care, students conducting research either on campus or off campus, students working in regional, provincial, or national branches of government and nonprofits, such as the Canadian Heart and Stroke Foundation or the Public Health Agency of Canada, and health and safety roles for larger corporations. This photo is Rachel. She was a health studies student who won the Co-op Student of the Year for the university, the province, and for the entire country of Canada. She worked at Sunnybrook Health Sciences Centre, working with radiation oncologists to provide patient care, developed research initiatives for palliative radiation oncology, and coordinated a radiotherapy program for people in the advanced stages of cancer. She published papers in medical journals that have been read by doctors all over the world. She is now in medical school, and a link to her experience will be in the YouTube video description as well. For students who pursue the regular program, there are still many ways to grow as a professional at Waterloo. They can adopt the EDGE certificate program. So it's a free opt-in program that aids in student professional development, and it will help you to develop your professional skills, explore career options, take various professional development courses that are also available to our co-op students, and learn how to market yourself to employers. Several of our own health courses actually count as experiential learning courses, such as a fourth-year community learning project and a health apprenticeship course. Students also have many options to customize their degree. They can adopt specializations within the School of Public Health and Health Systems, such as a gerontology minor or a health informatics option, or they can specialize outside of the program. So they could do a minor in psychology, for example. This photo is of Rachel Thompson, a graduate of our program who started her own enterprise creating books for older adults with cognitive impairments. Another way students can customize their degree is to apply for an accelerated master's. This is available to public health and health studies students who are planning to pursue a master's degree in the School of Public Health and Health Systems. We have options such as a Master of Science, a Master of Public Health, a Master of Health Informatics, and a Master of Health Evaluation. And students will have the ability to work ahead to take master's courses as an undergraduate student. This slide highlights what some of our health studies students are doing after they graduate. So about 52% go on to professional or graduate programs in areas such as medicine, public health, occupational therapy, and about 40% are starting a career right away. And these are just some job descriptions from some of our students. So there are many different ways to help others and to make a significant impact on human health. Waterloo Studies grads have a choice. For those who feel their path in human health is to work as a physician or other primary care practitioner, you can tailor your courses for preparation for applying to those professional schools. Other students, even some who enter the program with a primary focus on becoming a primary care practitioner, discover strengths and interests that take them on career paths aimed at improving health at the level of the community or the entire social system. At a community and systems level, our students are prepared to address the social determinants of health, poverty, unemployment, early childhood development, and so on. We ensure your studies allow you to see beyond the cell, beyond the individual, beyond the community to consider national and international aspects of health. I hope this information has helped you to understand how Waterloo approaches health studies and the types of opportunities we can offer our students. If you are interested in learning more about admission requirements, please visit the uwaterloo.ca future admissions link. You can view an electronic copy of our health studies brochure that lists all the courses that we offer throughout the degree by clicking on the link for the health studies brochure. If you've already applied, you might be wondering about your next steps. We will continue to make offers until our final round of admission in May. You can learn more about living on campus. And if you're interested in joining us at Waterloo, make sure to accept your offer by the deadline and submit the Residence Community Ranking Form and deposit if you plan to live on campus. Thank you for taking the time to watch this video.